It's your girl Shay Star. You already know what it is, man. We are live right now in NYC at the Allied Service Center, AIDS Service Center, NYC AIDS Benefit. And look who I have with me right here. It is the CEO of the company, Miss Sharon. How are you today?
I'm good, thank you.
AIDS, what a tremendous topic that nobody wants to talk about.
I know. I think that with so many treatment advances, there's a perception that AIDS is no longer a crisis and that AIDS can be managed through medications. And on a certain level, the meds have been transformative and have really prolonged life. But there still is no cure. There's diminishing government resources, and there continues to be really unlimited need for support services in the community, for education about getting tested and learning about your status, finding out about treatments and getting connected to care. And then also the challenges of if you thought you were going to die from this virus and then you find yourself living, but other folks who had been in your life are no longer here. It's a challenge to find your way back. And our organization, AIDS Service Center, Allied Service Center, we try to create community and create support systems that can help people. So we do HIV and Hep C screening, we have peer education, we have connection to medical care, and we have safe practice counseling services. And when you put all that together, the food pantry, the meals, the supportive environment, you really create a place where people can be the best that they are and can eventually even give back to others through our peer education program, where the peers get educated and then they become the role models delivering the messages out in the community. So it's a beautiful program. We're really proud of our work.
That is amazing. And you know, I wanted to ask you this. What was it about AIDS in particular that made you want to get involved? Like, did you know somebody? Was there a personal connection? What was it about the AIDS community that made you say, we need to fix this and I'm going to do this now?
Well, on a personal level, I have lost many good friends to HIV and AIDS. And in the early days of the epidemic, in the late 80s and the early 90s, I was going to a memorial service once a week. I mean, people were dying, tens and hundreds of people. And our communities were really being robbed of the education, and also the virus was hitting young gay men, and it was hitting young communities of color, and the impact was really devastating. As there became treatments, you needed organizations like ours to teach people how to get into the treatments and how to manage the treatments. And now I think that as people living with HIV are living longer, their health needs are changing. So while their HIV status may not be their priority issue, they have diabetes, hypertension, high blood pressure, trouble with nutrition, obesity. And so the chronic health conditions in the community impact people with HIV even harder. And the challenge today is that community-based organizations like ours in some ways are under assault because the federal government is really moving away from community-based service and is medicalizing the reaction to HIV. So they're saying that prevention is treatment. And while treatment can help reduce infection out in the community, primary prevention and education must be a partner with the medical establishment. And so events like ours tonight, HEAT, are trying to bring the message that safer sex can be sexy, and that we have to have explicit prevention messages in partnership with the medical treatments, that it's not one or the other, but that we need to work together as a community to address this virus and to fight, reignite the fight, because there still is no cure, there is no vaccine, and it still is taking away the livelihood of hundreds of thousands of people. In New York alone, there's, I think, 125,000 people who are living with the virus and don't know it. So our work is ahead of us, and in these times of diminishing resource, we really need the government, we need corporations, and we need communities to work together.
I was going to ask you, how hard or difficult is it for you to actually continue your work knowing that those resources are diminishing? Like, what is it about this fight that keeps you going? that's saying, you know what, I don't care, I'm just going to do this anyway?
I have to honestly say it's our peer education and training program. I see people who come to us starting as clients, having hit bottom, and they summons the courage to walk through our doors, and then they take charge of their health, their life, their housing, their choices, and then they do the peer training program and they become role models and they give back in the community. And when I see these people and witness the positive changes that they make in their own lives, and then taking that change and putting it forth out in the community, they are my heroes and they truly inspire me.
I love that. I love that. So what is the demographic? Are we just targeting one particular age, one particular race? Or are we just trying to just go for the gusto and get them all?
Well, with limited resources, you can't get them all, but we target low-income minority communities. We have specialized services for women of color, for the LGBT community, and for folks who are dealing with addiction and mental illness. And we create a safe environment where we bring them the support and connect them to the services that they need. So it's a tailored approach to a really extensive social problem.
Ecstatic. Like, that is so wonderful. When I first heard about the organization, I was like, I'm absolutely going to support that, because me being a minority, a young black female, and knowing how the disease has spread throughout my community, it's like we can't be scared to talk about it, you know.
Right.
And I appreciate, you know, the Alicia Keys and other people in these community figures who are willing to talk about it, you know. And I heard Alicia Keys did an interview on CNN, and she said that we need to not be afraid to talk about it. You know, people are just, like you said, sweeping it under the rug. They think, oh, because we know about it now, it's not a secret anymore. People just kind of like brush it under the rug. But we really need to talk about it, because 125,000, that's a lot.
It's a lot.
That's a lot.
It's a lot, yes.
That is an excruciating number, actually.
It is, and it means that the work is unfinished.
Yes.
And it means that the need is extremely high. And the potential for us to have a positive impact exists, but we need the resources to help us to continue to take these messages out into communities and to forge the partnerships with the medical providers and the community providers, the churches, the schools, so that we can get messages about safer sex practices and safe harm reduction approach to drug use. You know, abstinence is not right for everyone, but there are ways that you can reduce the harm, reduce the risk, take better care of yourself, and when you are ready, there are services out there for you.
I love what you said, that safe sex can be sexy. That was like the coolest thing I've ever heard in my life. Like, you know, people shouldn't be afraid to talk about it. And, you know, condoms may seem so cliche, but you'd be surprised how something so small as that can really save your life. Absolutely.
Yes,
so,
absolutely.
High five to you.
And
yes,
to you,
thank you so much. I'm here, whatever you guys need.
Appreciate your support.
Absolutely.
And, you know, we're looking for donations. We look for volunteers. Any way you can give, it has a positive impact, and no gift is too small, whether it's a gift of time, a gift of money, a type of service. www.ascnyc.org.
Twitter, Instagram, Facebook, you know,
all that jazz, yes.
Well, I want to ask, who do you have also supporting? Do you have any other major figures, any other voices besides your own that are out here plugging this into the community?
You mean at the party tonight?
Well, just period, yeah. And
well, I have to say that our organization has been blessed with a lot of government support. We get funding from the New York State Health Department. Umberto Cruz just recently stepped down. He retired. He had been the executive director of the AIDS Institute for many years, was a huge friend of ours, and a huge supporter to the AIDS community. We have funding through the Centers for Disease Control, the Substance Abuse Mental Health Services Administration. They understand that community-based organizations have a role in this epidemic, and they are putting prevention dollars out into communities across the country, and we are their partner. We're a big partner with the New York City Health Department and the Ryan White CARE Act that funnels $100 million into New York. The challenge is that, unfortunately, because of sequestration, because of budget deficits, and because of impasses at highest levels of government, the trickle-down effect is that sequestration means cuts to funding, cuts to services, cuts to jobs, and it's really shameful. It is shameful, and Congress needs to get their act together, pass a budget that makes sense, and that puts resources back into our communities. Yes.
I can't agree with you anymore. So ShayStar.com definitely supports ASC and everything you guys need. So please don't hesitate to let us know about events. You know, we're here tonight.
We're doing another event in October. It's called Unmask AIDS, and it's really to uncover the stigma, fight the stigma of HIV, and we would love to have you come back for that, October 28th.
I'm there. ShayStar.com. We're going to sign out. We got a lot of more lovely things going on tonight, so just stay tuned and we'll keep you updated and informed. Thank you very much. Bye.
Bye.
ShayStar.com still live on the scene at the ASCNYC event. And look, I have the pleasure to sit down and talk to Mr. Remy Mars. How are you, sir?
How you doing? I'm pretty good.
I'm excited to be here, and I'm so glad to see a young black man here as well. Because as I was talking to Sharon earlier, you know, a lot of people don't understand that this disease affects our community in volumes of numbers.
It does.
So what was it about the organization that made you want to say, you know what, I support this, I'm going to come out and have a voice in this?
I've always been vocal as far as a cause, and I've been working with SWAG for about a couple years now, and I like what they represent. It's a good cause, of course, and even what we're doing here today is for a good cause. And like you said, a lot of our people in our community are affected by this. And the number is crazy, actually. I think it's actually larger than what it's ever been. But this is definitely going to bring some awareness to the community, and you know, I definitely appreciate everyone coming out to, you know, show their support and, you know, just to give back.
Absolutely. So is there any personal connection that you have with this, or is it you just really understand the need that we need to be more vocal about this?
I just understand the need. You know, there needs to be a lot more education and a lot more voices out there to, you know, put the cause out there. You know, spread the word. I feel like there's a silence. There's a whole don't ask, don't tell, and that's just killing us faster. You know, we need to change that. You know, we need growth. And that's pretty much all that we're asking for. You know, just to give back, you know, see the problem that's out there, understand it, and see what we can do about it.
Yeah, and that was one of the things that I was, you know, discussing with Sharon. You know, I think it's sad because we've gotten so used to hearing about it that people just kind of brush it on their rug. And like you said, don't ask, don't tell. You know, it's like you can't just look at a person and just decide, you know, whether or not they're healthy or not, or whether or not they're going to be a good partner for you. So, you know, we got to really take this serious, you know. And, you know, they glorify, you know, the Magic Johnsons and these people who have miraculously beat the disease, but what about the tens of thousands and millions of people who are living with it and don't even know? You know?
Yeah, like, what are we going to do about, you know, just the average individual who can't find the medical support? And exactly. And that's pretty much why I think this whole organization is about, just reaching out to everybody, showing that there is support. There's a plethora of stuff that we can do, and you don't have to be a Magic Johnson type to beat this. This is definitely something that can overcome. It's definitely not the same disease it once was years ago. But honestly, I think that's also kind of the issue too. People don't have that fear anymore. So therefore, you know, they feel they can live lives recklessly just because they can go somewhere, get a pill or get a shot and be done with it. And still, that's still just, you know, an ignorant way of thinking. You know, we're not protecting ourselves, we're not protecting our neighbors. So hopefully, you know, we see a lot of change within that. I definitely look forward to some change in that.
And not to mention, you know, the entertainment business has a major influence on that. You know, that conservative era, you know, we're not in that anymore, you know, especially in the millennium, man. You know, everything is all about smash and pass, you know. So it's like, you know, not understanding that alone is adding to the problem, you know.
You know, they're starting to make it look cool, like it's the cool thing to do, when really, it's just, you know, we're just blinded. You know, we're not seeing the bigger picture. we're not really seeing who's really affected.
Absolutely.
And then, like I said, the number is just growing and growing and growing. And the age, the youth, actually, I think the youth is what really gets affected. Because, you know, they're our generation, they're behind us. So, you know, they're the ones that got to make the difference.
Because you take it when it first hit, you know, the scene real heavy back in the 60s and 70s. Like you said, everybody was scared. But we've grown up with this now, so it's just like another thing, you know. But it's really, they need to understand that it's not just another thing. You know, we really need to take heed to what's going on. And again, I salute you for coming out today to support the cause. And I can't wait to see how we can fight this thing and beat it further in the future. So is there any, you want to let everybody know where they can find you at? What exactly, I didn't even ask you, what exactly do you do?
I'm an adult film star for the urban gay entertainment business. And right now I'm just here pretty much just giving SWAG my support. Like I said, they're organizations I've been working with for a while. I like their cause. And just as far as what I do, I feel like...
Yeah, how does that affect you in your profession?
It's just, I don't let... It's not my life. It's just a piece of who I am,
okay.
But it's not totally. Like I said, I still want to give back. I still just me being in the position that I am in. I need to do more to give back to my community and give back to the youth, to show that it's not all of just entertainment.
Right.
There's a responsibility that we have. I feel like we're kind of like mentors in a sense. So it is like our responsibility to show a better way of living, a better way of doing things, a better way of thinking and stuff. You know, we got to change the stigma.
And I was going to ask you, like, do you feel like there is a stigma that comes with it, considering what you do? It's like, well, how can you say that you want to fight for this, but, you know, maybe you're promoting, you know, the action, you know what I mean? But I appreciate what you said, you wanting to give back, wanting to let people understand that it's just entertainment, but understand the consequences and everything that comes behind it when you're dealing with it in real life, you know? And I'm pretty sure it's a lot of safety precautions that y'all have to take in order to be, you know, a part of that particular profession. So does it ever cross your mind, or are you ever scared before you go into work, you know, with certain things?
I mean, there's always that nervousness, but I'm big on just like protecting myself and just making sure I'm in a good position to protect not only myself but whoever I may be working with, and I just think that's the most important thing. There shouldn't be like this selfishness. I just think we're all a community. We all affect each other, you know. There's like a 6 degrees in a sense. We're all kind of connected in one way or another. So what affects one person could end up turning around affecting a whole line of people. And that's what we got to change. That's what we got to, you know, put a lot of focus in. And just to focus on those who feel like they're alone, they're silenced, they feel like they don't have the help or they don't have the support. You know, just like ASC and a lot of other organizations, there's a lot of people here, but not a lot of people want to do the research. Not a lot of people want to get out and actually take the effort to see that, to actually say this is a problem.
Right. No, and I totally agree. That's been my whole spiel on this whole thing. You know, we can't be afraid to talk about it. So again, I'm going to thank you again for the time, you know, for talking to me, and I look forward to fighting the fight with you as well.
Thanks for coming.
Anytime. So Remy Mars, guys, look him up. Be sure to wrap it up. I'm just saying, you know. ShayStar.com, we out of here. Savanna SAMSON, ladies and gentlemen. What is your involvement? What is your vision? What is your ideals with the whole AIDS epidemic? How do you feel about that?
Gosh, that is such a loaded question, because as an adult performer, I mean, when I first started with Vivid, it was mandatory condom.
Really?
So, and I was one of the advocates for getting rid of that, because I like the idea of the safe sex on camera, but as a performer, we'd have to be tested every 30 days. And once we went optional, I would say, okay, so we don't have to use a condom as long as your test is within 3 days. But still, during those 3 days, a performer could do 3-4 scenes at least, during that time. So every time waiting for the test results has been like,
I can believe it's like excruciating.
yeah,
right?
but
Like,
I also know that, and that's me as a performer in the industry. And in the real world, do people actually get tested? I don't know. At least in the industry, we know
that
we can see someone right before you have sex. But like in the real, I say the real world.
Right, really.
So I just love what the AIDS Center is doing. They really look after those that do are infected with HIV, and I think I didn't even realize. I went to the center and I was like, wow, this is really amazing what they're doing for people. And since then I've really given up my time and myself and my clothes. Instead of bringing them to the Salvation Army, they go right to the AIDS Center. So if you want some nice clothes, there's always an upside.
Yes.
If you are HIV positive, you go to the AIDS Center and you have some Savanna SAMSON leftover clothes that are amazing.
I like her.
Yeah.
So what is, besides that, what is your contribution? What is it that you want people to understand about this AIDS epidemic?
Okay, when it first came out, it's like, okay, I do not have AIDS. I have cancer or something. And if you say anything, you're done, So it was something that was a taboo that you cannot talk about it. Suddenly there was AIDS awareness, and everyone can accept it, and everyone realizes nothing.
It's really a problem.
And it's a problem, and you need to work on it. And now in this day and age, right now, I feel that less and less people are actually talking about it, or even. How do I say, like, I'm so, promiscuous or out there, but it's like, you want to suggest using a condom maybe?
Yeah.
Because, you know what? Yeah. I was a performer. You might want to consider that I might have, you're just willing to have sex without a condom?
Right, just because you think I look good.
Yeah, because I look good, and you don't know. And I'll tell you one thing that's very important. There's a girl, her name's Roxy. She got HIV in the industry. And I was one of the few people, just so happens that, I just felt so bad. It could have been any one of us. I sent her a small check, when I heard that it happened. And a card that said, it could happen to any one of us. My heart goes out to you, whatever. So now she's doing she had cameras with her, just following her life after and everything. And do you know, I met her in Toronto to have an interview. She wanted to interview me and thank me on camera for sending her this check. And do you know that during that conversation, she's been dating a man for a year who doesn't know that she's HIV. Oh, wow. She said, well, as long as I use a condom, I'm like, well, what if that shit breaks? Like, don't you have, isn't it your obligation, or, your,
His right to know.
His right to know. But she's like, no, he just picked me up in a bar. He didn't ask. And I was like, but, so I'm telling you, if someone's HIV positive, they are not going to tell you, because as long as you wear a condom or whatever, they don't. And I'm telling you, and I was like, but this is a girl who's known in the industry now as not, of course, that's her pseudonym, but in her real life, she doesn't feel like she needs to tell, because then they won't want to be with her.
Wow.
And that is true. From her conversations face to face is what she told me. And I said, wow, I'm just saying, it's out there, people. You have to protect yourself, and we're not talking about it these days. We're not.
No. That has been my whole, from talking to Sharon, talking to Remy, and talking to, and I think, like I said, we're used to it now. Back in the 60s and 70s when it first hit, it was a shocker. Everybody was scared. They didn't understand it. But, these 1990 to 2000 now, we grew up with it. So it's not something that we're so scared of, but I think we need to be more scared of it now, because the numbers are growing massively.
And that's why, because people aren't saying, and because who wants to be alienated? You want love. You don't want to carry around this thing where you're diseased and people won't want to love you or be with you, and also people can live normal, happy lives with HIV.
Absolutely.
But it's, you can live with it these days, and so I don't know what the answer is, but it is great that they're doing this for awareness, and just to remember, especially these days.
I'm glad that you are willing to stand up and be a part of this as well. So I commend you for that, definitely. Yes. Savanna SAMSON, guys. Make sure y'all check her out.
Stand up, clean up, rise up. When someone comes to AIDS Service Center, they stand up and summons the courage to walk through our doors, get tested, get connected. They clean up, take charge of their health, their life, their housing, their choices. And they rise up, and as peer educators, they give back to others who, like themselves, are beginning their path towards healing. At AIDS Service Center, we take risks and give second chances without judgment, but with the profound belief in the ability to change. Absent a cure, prevention and treatment are our best weapons against the epidemic. And that's why we're here tonight. We're here to promote explicit prevention messages. We're here to support people to get tested and connected to care. We're here to protect ourselves and our loved ones. And we're here to have a great time for a great cause. So throughout the night, I hope you're going to cruise our Safer Sex demonstration tables, groove to Vic Latino's sexy beat, mingle with our amazing and sexy and very special guests, Savanna SAMSON, Shay, Remy, experience our unique condom fashion showcased by our very own and very handsome, in hope for a world without stigma, bigotry, and shame. In celebration of sex and sexuality, with towards wellness, in prayer for a cure and the blessed day when services like ours are no longer needed, to peace, health, dignity for all our brothers and sisters living with HIV and AIDS, to safer sex, one party at a time. Cheers to life.
You've been too damn good to me. I wouldn't wanna see